Welcome back to 1011 News at Noon. Joining us now is retired family physician, Dr. Dale Michels. Dr. Michels, thank you so much for being here.
Good to be here.
Yes, and today we're talking about, of course, October's Breast Cancer Awareness Month. And even though October is ending, you know, this is really something that's important year-round. And I see you wore a perfect pink tie for today's segment.
I wore a pink tie. It was the tie I first wore after our daughter was born over 50 years ago. So I've had it on the shelf for a while. It's not in style, but it is pink.
And it means a lot to you, and that
Yes.
matters. Yes. And so, talking about breast cancer awareness, where is a good place for women to start?
Well, I think, you know, breast self-exam has kind of fallen out of favor, but it's important to be in some routine to sort of know what your family history is one of the most important things, because they've now developed some awareness of some of the BRCA, breast cancer genes that are significant for women. So if your mother had breast cancer, or your grandmother, or your aunt, or those people, start thinking about screening much earlier. They recommend mammograms actually start 10 years earlier than the earliest person to develop breast cancer in your family.
Okay.
And as a reminder, we don't do mammograms with them, but men do get breast cancer too.
Yes.
So if middle-aged men start to develop a lump in the breast, don't ignore it. Pay attention to it. Young kids, interestingly enough, who are going through puberty will sometimes get a breast lump, but it almost always goes away by the time they're 16 or 18. Not a big worry to watch, just pay attention to it. But for women especially, which is where it's more common, getting your mammograms, getting regular exams, making sure you know what's going on with your body is important. Knowing what your genetics is important, and, you know, getting a mammogram. Now most insurance companies do cover them, thankfully, so they can get them. Some people get breast ultrasound to check a lump. If they find a little lump, they can do an ultrasound.
Okay.
And there's MRI of the breast, which can be done too. It's more expensive. It's probably needed mainly for those who have really thick, dense breasts that are hard to examine otherwise. If you're a nursing mom, you want to wait till after you're done nursing, because sometimes there's some lumpiness that develops just with nursing, and that can freak you out that you don't need to be freaked out. Halloween's enough of a freak out. We don't have to do it for this. And doing it regularly for women who are having periods every month after their period, just doing it regular, getting in the routine, making sure they know when their last mammogram was, getting it scheduled. Thankfully, we have better treatments. They're improving, but best thing, as always, is finding it early or preventing it.
Absolutely. Now, if you don't have a family history, what age do they recommend?
Well, I think now the current age it's dropped since even I was in practice, 40 to 45 generally, certainly at 50.
Yeah.
But, you know, somewhere down in that range, you know, just getting in the habit of getting done. It's not a comfortable procedure, but it's not the end of the world, and it takes very few minutes, and just making sure.
Yeah, and it's important. All right, well, Dr. Michels, thank you so much.
Good to be here.
We'll be right back with a final check of Brandon's forecast after the break.